Hello, I'm Coach Jessica, and if you've been watching my videos over the last couple months, you know I've mostly been doing videos about different ways of eating to try to help you find the best way of eating for your health goals, your lifestyle, and your conditions. Now, I'm going to start moving into a different area based on some viewer comments and also suggestions by Burn Along. I know diabetes is a huge health issue for a lot of people, myself included. Most of my practice I work with diabetics because I am a diabetic. I was diagnosed with type 1 diabetes when I was 8 years old and have handled it and lived with it most of my life. So I have a special expertise and a heart for helping people learn how to manage this complicated and frustrating condition sometimes. So today we're going to start by looking at the general vocabulary of diabetes. If you've just been diagnosed or your doctor is telling you, oh, your blood sugar is a little high, that can be kind of scary, and there's a lot of new things that you're going to be hearing. And I just want to make sure you have a good understanding of some of these words as you're moving through and learning how to manage this disorder. So you've been diagnosed with diabetes or pre-diabetes or gestational diabetes. So what? What exactly is diabetes? Now, diabetes is a group of chronic disorders that result in the body's inability to break down carbohydrates into sugar to be used as energy. Now, if you haven't already done so, please go back and review my vocabulary of nutrition video. Some of the words that I defined in there are going to be a part of this presentation, and I'm not going to spend a lot of time redefining those words if we've already covered it. So go back and check out that video. There's another video or two that you might want to check out to give you more information about a couple of the other things we're going to discuss, but I'll let you know when we get to those parts which videos are ideal for that. So first is, what is a chronic disease? Now, the Center for Disease Control, or CDC, defines chronic diseases as a disease or condition that lasts 1 year or more and requires ongoing medical attention, limits the activities of daily living, or both. Now, the World Health Organization's definition is a little bit different, but similar. Basically, chronic diseases are non-communicable. That just means they're not contagious. You can't breathe your diabetes onto somebody else, and they can't do the same to you. It is of long duration, meaning it's a lifelong thing, and it is a result of a combination of factors, especially type 2. There's genetic factors, there are environmental factors, and there are behavioral factors that can all culminate in a diagnosis of diabetes. So what exactly do you need to know? What are some of these words that I keep hearing about? What do they mean? We're going to start with the very, very basics, the pancreas. Now, the pancreas is an organ behind the stomach in the upper left abdomen, up in here, that is responsible for making hormones that help with digesting food and converting it to energy. Now, the beta cells are a specific specialized type of cell that's found on a part of the pancreas called the islets of Langerhans. Sounds like a nice place to visit. But those islets are where the beta cells are that produce the insulin that we need. Now, blood glucose, or blood sugar, what that is a measure of, it's a measure of the amount of glucose that is found in the blood. And it is measured either in milligrams per deciliter, mgdl, that's how the Americans measure it, or other places in the world, sometimes you might see millimoles per liter, mmol/L. And a normal blood glucose level is between 70 and 99. Below 70 is a little bit too low, and above 99 is too high. Now, a nice, normal, beautiful blood sugar. I love it when I get 83 when I check my blood sugar, because that is a perfect blood sugar. Right in the middle of that normal level, and that basically a person without diabetes, their blood sugar tends to stay right around 83 or 4.6, depending on how you measure it. Now, insulin. We already mentioned that word, and I already said it's a hormone. But what it is it is one of the most, well, no, it is the most crucial part of understanding diabetes is insulin and how it works. Because it's a hormone that's produced by those pancreatic beta cells that acts as the key that moves the sugar in your blood into the cells of your body. And in those cells of your body is where that sugar is then converted to energy. Now, insulin resistance is a common feature of all types of diabetes. What it means is when the cells in your muscles, fat, and liver don't respond correctly to insulin. And that can be either the insulin that your body creates, especially with type 2, or if you're a type 1 or other types and you inject insulin, your body can become resistant to that insulin. And what that means is it will have difficulty moving the sugar out of your blood into your cells. And the result is your blood sugar levels become elevated. And here are some of the symptoms of insulin resistance. And it's usually the first step towards developing diabetes and often begins occurring long time before overt symptoms become apparent. We'll talk a little bit more about insulin resistance when we talk about type 2 diabetes next week. But for now, that's just a basic definition. Now, hyperglycemia. This always makes me laugh because it's also called high blood sugar. If you hear a diabetic say, "Oh, I'm high," that doesn't usually mean drugs. It might, but when I say, "Oh, I feel high," it means my blood sugar is high. And I'm experiencing elevated levels of blood glucose. And some of these symptoms are kind of nasty. I definitely feel fatigued and blurry vision, very, very thirsty. I get hungrier sometimes. Sometimes I get nauseous. And sometimes I get really cranky. That's one that they didn't list on there, but that's a pretty common side effect of hyperglycemia. Postprandial just means after you eat. So if your postprandial blood sugar is very, very, very high, I think usually the level where they'll say you have insulin resistance or diabetes of a postprandial blood sugar over 200. Now, hypoglycemia is the exact opposite of hyperglycemia. It just means low blood sugar, and it's a depressed or low amount of blood glucose in your bloodstream. Common symptoms. Now, this can be scary. Generally, hypoglycemia or low blood sugar doesn't happen until after you're being treated for diabetes. Usually, a couple things can cause hypoglycemia. Either too much medication of whichever type, if you're taking insulin, if you're taking metformin. Too much medication can cause your blood sugar to go too low. Not enough food can cause your blood sugar to go too low. Or extra exercise, like unplanned exercise, can also cause your blood sugar to go too low. And for people with diabetes, especially type 1 diabetes, this can be very dangerous because if you pass out, you can go into a coma and you can have seizures, and it's very scary. It's happened to me a couple times in my life with diabetes. Not too often, though. Now, ketones, we've already talked a little bit about ketones in my keto diet video. So just a quick review, it's basically an alternative fuel source for the body that happens when the body begins burning fat or protein, and that can be muscle. If you're with your blood sugar too high for too long, your body may start to burn the muscle for fuel instead of glucose. Now, nutritional ketosis by itself is not dangerous. It is not dangerous. And again, for further explanation, please go back and view my keto diet video. I spent quite a bit of time discussing the difference between ketosis and dangerous ketosis and this next thing that we're going to talk about now, which is diabetic ketoacidosis, or DKA. Now, this is usually one of the first symptoms. Usually, it can be one of the things that they use to diagnose diabetes, but it's a dangerous complication of diabetes that happens when all of these factors come into play. Dehydration, high blood glucose levels, and not enough insulin. When this happens, it can make your blood become acidic, and if it's left untreated, DKA can lead to coma and death. Now, I have had DKA a couple times during my years as a diabetic as well. Luckily, I was able to get treatment, and they rehydrated me, got enough insulin in me, and I was able to come out of it. So it is treatable. It's not going to necessarily kill you, but if you have any of the symptoms of DKA, please seek medical attention right away. Don't wait. Don't stay at home, or don't call, make sure you call your doctor or medical team and get help dealing with this. Now, the last thing we're going to talk here, actually, no, not the last thing. Next, we're going to talk about hemoglobin A1C. You're going to hear a lot about this. What's your A1C? Because the A1C is a measure of the average blood sugar level in the last 3 months. Basically, it measures the amount of glucose that is clinging to red blood cells. Now, red blood cells have a lifespan of about 3 months, which is why the A1C is a measure of your blood sugar levels over the last 3 months. A normal A1C is between 4.0 and 5.6, and as you can see, the glucose in your blood will attach to these red blood cells, and that is how they measure the A1C. Now, everybody hates hearing about complications. I remember when I was first diagnosed and people would tell me all the horror stories. Oh, my nephew's cousin's sister lost her foot because of her diabetes. She had to have her foot amputated, or they ended up on dialysis. All these scary stories about complications. Complications in a medical term are defined as an unfavorable evolution of a disease or health condition. And unfortunately, uncontrolled diabetes can cause complications with almost any part of your body. I personally had to have several, before I got control of my diabetes, my eyesight was being very badly affected. I've had a couple other issues happen because of complications from uncontrolled diabetes. But the good news is, once you get control of your blood sugar and normalize those blood sugar levels, your body can heal itself. That is the wonderful thing about the human body. It's an amazing thing. So if you have any questions, please let me know. Leave comments on the video. I would greatly appreciate a review as well. And of course, 5-star reviews are always appreciated. And if you make me a favorite, that'll make sure you don't miss out any of the future videos as we keep talking. So next week, we're going to move into a discussion of the types of diabetes. I'm not going to go super deep into it because that can be very, very long and drawn out, and there's lots of different types of diabetes. But they're all kind of related. So I'll give you an overview of them and kind of show how they're all related. And in future weeks, we're going to talk about some tips and tricks on how to normalize your blood sugar so you can avoid those complications and start feeling better and get on less medication, maybe help lose some weight, all these other things. Please reach out to me through my business, Total Health and Fitness of Tampa Bay. You can reach me at my website, totalhealthandfitness.co, or you can email me, jessica.tucker@totalhealthandfitness.co, not .com, just .co. And I look forward to speaking to you next week. Thank you so much for joining me.